Hi there, everyone, and welcome to our webinar today for the Community Health Strategist program. And I just want to introduce Dr. Curtis Noonan. First, I just wanted to start by asking if you are currently not speaking, maybe mute yourselves, and I can also mute you all. And then also, yeah, just if you wouldn't mind staying muted while Curtis presents. We are going to leave some time at the end and hopefully have a discussion. But we're really lucky today. We did have a change in presenters. Aaron Simmons from University of Montana had a last-minute schedule change, and so we are really lucky that Curtis Noonan was able to jump in here and present for us. And you all probably are familiar with Curtis. He's been around Montana for some time doing research and teaching over at the university. He is a professor of epidemiology, and he specializes in environmental health. I think I sent you all a little bit of his bio, but he has numerous degrees, and I know he's done a lot of work at the federal level too with ATSDR. And we really appreciate his expertise and his willingness to join us. So I think he's really a great person to talk to us about this practice number 3 that you all know is really aimed at identifying, analyzing, and distributing information from new, big, and real-time data sources. And I would like to add also from some just good old-fashioned reliable, run-of-the-mill public health sources that we've been using for a long time. So he's going to talk a little bit about some of the bread and butter public health data sets and sources of information, and also about some of the more new and real-time types of information we have access to now. So I'm going to turn over to Curtis now. So thank you, Curtis.
Great. Thanks, Jane, and thanks to all of you for joining us on this lunch hour. Yeah, I appreciate that your microphones are muted, but I do also want to say that as I go through, if we get to a point where you have to ask a question, just feel free to just jump right in and interrupt me. I'm kind of going to be alternating between some slides and some websites. So I may not be able to monitor the chat window or things like that. But, you know, if you want to, just don't hesitate to interrupt me. That's perfectly fine. And then as Jane said, we'll leave plenty of time at the end for questions. So yeah, I'm just going to share my screen now and pull up some slides to start with. Okay, so you should be able to see a slide that says Community Health Strategist webinar. And so we're going to be talking about a pretty challenging, I guess, item number 3 on the Community Health Strategist planning document, which is about new, big, and real-time data sources, which is extremely challenging and sounds like it should be pretty easy to have these data available to us, but oftentimes that's just not it's not as simple as it's cut out to be. So as Jane described, I will kind of discuss a little bit of some of the data you're currently using, some of the data we use in our research here at the University of Montana, and then maybe some things that are on the horizon that may be promising in terms of data moving forward. So it'll be a bit of a mixed bag for sure, and so you'll just have to bear with me, but again, just interrupt me as we move along if there are questions. And I want to thank again Aaron Simmons, my colleague here in the School of Public and Community Health Sciences, who put a lot of these slides together, and she apologizes that her travel schedule just evolved in the way that it did, and she's just not able to join us. So you have the B team here today. So I want to start by just taking a look at this map. I know it's too you might not be able to see the detail in this map on this particular slide, but this is a map that was generated by a group here in the Missoula City County Health Department. And what this is showing is for certain parts of Missoula, you see the Clark Fork running through it, and you see a bunch of green lines and a bunch of red lines. And what this is a representation of sidewalks in Missoula communities, with the red indicating areas where sidewalks are non-existent or not up to par to encourage walking in communities, which we know is an important cross between what we call the built environment and people's physical health. And so the reason I wanted to start with this is because the Missoula City County Health Department has engaged in this, sorry, just trying to go to the next slide. Hang on. There we go. So this Missoula Invest Health project is a pretty unique endeavor with collaborations between health agency personnel, folks at the university in various departments, folks in the in other city county departments, including things like Department of Division of Transportation or Parks and Recreations, and then also individuals that are working in the health provider community, whether they be from hospitals or clinics. And this was started by a team that's pictured there on this slide: Kai Peterson, Mary Hutton, Susan A. Patrick, Laval Means, and the leader of this group is Lisa Miskevich, that is the health promotion director for Missoula City County Health Department. And what they decided to do is to focus on particular neighborhoods that were considered to be vulnerable neighborhoods with respect to health risks and behavior risks, and lesser levels of infrastructure. So in a moment, I'll show you their website and some of the things that they've done. But they've also been able to leverage some funding through the Robert Wood Johnson Foundation. As I said, it's just been a collaboration that they've built from the ground up, bringing together lots of stakeholders across Missoula. So I'm going to switch now to, sometimes this is hard to, let's see. I'm going to switch to my browser so that we can take a look at their website. Let me just find the right, hang on, just bear with me. That's not it. Is that right? Might have been, that's not the right thing, sorry. Shoot, hang on, let me just minimize my screen here. I'm sorry, I thought I had the, oh, okay, I see the problem. Sorry, you guys.
Don't worry, we're patient.
Why can't I find the right? Okay, I got it. All right, so hopefully I'll get better at toggling back and forth between slides and websites. But this is the Missoula's Invest Health website. And the reason I wanted to bring us here is so that we could explore the map that they've created, which is pretty cool. And I'm just clicking right here on the right-hand section of the website, and it pulls up this map, and then you just gotta say, you've read the disclaimer, which I'm not sure if I have really. And then on the right here is a menu of lots of different infrastructure pieces and lots of different statistics. But first, I'm just going to kind of zoom in on Missoula City proper. I may have zoomed too much, but let's just give it a try. And so then if I click on the statistics tab and I look up, I mean, they've got information on demographics and other information. Under infrastructure, they got information on urban forestry and transportation, like roads and routes. But I'm just going to focus on the health statistics for right now. And as you can see, they've got a variety of different, not only chronic health conditions, but also behavioral risk factors that are in here. And we'll see in a moment where they're capturing these data from. And I'm just going to select on, I don't know, I'll just pick the first one here, adult diabetes. And what they've done is they've created in here, and it's a little bit difficult with the labeling they have because it kind of clutters it a bit. But sorry, I'm just zooming in a little bit more. And so what they've got here are prevalence of adult diabetes by these different areas, by these different neighborhoods that are largely based on census level data, as we'll see in a moment. And what they've used these data and other sources of data collection to identify the neighborhoods that they want to focus on to develop more public health outreach and program interventions and infrastructure. So it's a pretty useful tool. And now I'm going to share with you where they're getting some of these data from. So if we look here, I've got listed a variety of different data sources that they've used to capture this. And so one of the first things I've indicated here is a GIS specialist. And this I just put in there because, they had someone helping them with their mapping, et cetera. And, we have to kind of keep in mind, I think, how much infrastructure and capacity local health department like Missoula has compared to some other local health departments in our state of Montana. So, most of us don't have access to a GIS specialist who's going to do this, or to someone who's going to sort of lead, something like this Missoula Invest Health effort that's going to have the time to be able to devote to this. So I think that's one thing we all need to sort of, I always keep this in mind is, different levels of resources that we have across our various counties and local health departments. But just going along some of the other areas of data collection that they've used as part of this project, they do neighborhood walks, and that some people might refer to that, if you got a larger area, you might refer to that as a windshield survey where you drive around and look. But they really wanted to get out in the neighborhoods and figure out what were the barriers to people getting outside in their neighborhoods and walking and engaging in physical activity. So that was a really intentional choice by them to do these walkarounds. They also did door-to-door qualitative surveys, and they did that in collaboration with one of our community health classes here at the university, led by Annie Sontag. So they gathered qualitative information about people's reflections on their neighborhood and barriers to engaging in physical activity or healthy behaviors, etc. So that was another piece of their data. And then they, as I mentioned, that part of their larger network involves collaboration with lots of other agencies and divisions within the city and county of Missoula. And so they got input from transportation and planning, parks and rec, nutrition services, etc. And then they also have other nonprofits that are participating in providing data for their health maps. Or not necessarily their health, but their maps in general, so that they can locate where there are access to services and whatnot. And then health, I really want to spend a little bit of time focusing on where they are getting their health data. And so a big chunk of their health data is coming from something called Policy Map, which you could look that up and you could do a free trial of that. And some of you may have already explored Policy Map, and it basically just captures data from a variety of sources. And I'm going to do a little deeper dive into where they're getting their health-specific data. But that includes information they've also captured from the Behavioral Risk Factor Surveillance Survey, the American Community Survey, and the census. So just flipping screens here again, because I wanted to take a look at a specific document. So this 500 Cities project, and the Policy Map folks, as I said, gather a lot of information from a variety of sources, but one of the big ones in terms of health outcomes is from this 500 Cities project, which is led by the Centers for Disease Control and Prevention. And as you can imagine, a 500 Cities project means that they focus on the 500 large cities, right? So really, in terms of Montana, the only two cities that are evaluated as part of the 500 Cities project are Billings and Missoula. But for those two cities, they do capture quite a bit of data that is at sub-county level. And that's important for a program like the Missoula Invest Health program, because they're really trying to focus on targeted interventions in specific neighborhoods rather than sort of county level interventions. So being able to have health data at the neighborhood level can be really useful for such programs. And so this is just, they have these, documents for any of these 500 cities that are part of this 500 Cities project. And this just, shows you that they're capturing the information. And I just wanted to point to you, if you maybe can't see this, but I'll just highlight it here. This is where they're capturing their data. So they're capturing the data from the Behavioral Risk Factor Surveillance Survey, which of course is, as we know, is self-reported health data. That's for 2015, 2016. So in terms of temporal, like our sort of time resolution, it's not bad. It's maybe 3 years old. And then they've got data from the American Community Survey, which is run through the U.S. Census Bureau. Some of those data go back to 2011, 2012, so maybe it's a little bit more dated. But what they can do is provide prevalence estimates for all kinds of health outcomes, and they create these maps for prevalence of, in this case, arthritis among adults 18 and older by census tract. Okay, so it's really in terms of spatial representation, pretty good, or at least better than county level data can be in terms of understanding where some of your health risks might be. And then they also, of course, get into other things like preventive services, lack of health insurance among adults, access or frequency of preventive services, access to preventive services. So lots of different data that are available through that. But as we know, that's kind of not the world that most of our counties and communities are in, because they won't have data that's that spatially resolved through these mechanisms. Although, of course, a lot of these same data that I'm talking about, these same data sources are available at the county level. So I'm going to spend a little bit of time now talking about different types of data. And so I've grouped it into 3 areas. One are what I'm referring to as health outcomes and behavioral risk factor data that are available through queryable sources, right? So that all of us can have with fairly little learning or ramping up to usability. These are pretty easy data to capture and get to, whether it's mortality data. These are just examples too. There's plenty of others, of course, but mortality data that we can capture through the CDC website, behavioral risk factor surveillance survey data, or through our state health department of Health and Human Services. something like the IBIS data system, which uses a lot of different data sources, including the hospital discharge data system, to provide information about health conditions. So all of those are pretty easy to use queryable data sets. And so just going over some of the advantages and disadvantages. So the advantage is that these data are readily available, right? Easy to get to, easy to use. And we are pretty confident that these data have gone through pretty rigorous quality assurance and quality control checks. So the data are pretty solid in that regard. But the disadvantage, of course, that you all are familiar with is that there are delays in terms of when the data are released. Those delays are becoming shorter and shorter, but they're still, it's not what we would call real-time data or anywhere close to it. And then, of course, as something that I already alluded to, there's sort of this very crude geographic resolution for some communities. In most cases, we only have data at county level. And in some cases, when we're talking about more rare conditions and more rare mortality causes of mortality, those data might not even be available for some counties that are sparsely populated. The second area is health data that's in collaboration with our state health agency, the Montana Department of Public Health and Human Services. And so just some examples here are things like our Montana Hospital Discharge Data System, vital records, and surveillance data such as like influenza surveillance program, or the MTRACS data set, which is the state-based immunization tracking system. And in a moment, I'm going to share with you some examples of some collaborations that we've developed with the state health department to work with these data and to explore some research questions that we have. The advantages, of course, of working with these data systems is that you get to work with some of the folks at the state that are really familiar with these data systems and know the ins and outs and the strengths and weaknesses of these data sets. And similarly to the above group of data systems, they go through pretty rigorous quality assurance and quality control process. Some of the disadvantages might be that some of the data can be cumbersome to use. There are concerns of privacy, which our group has been working through some of the issues related to that problem, but that can impact your ability to link data or to get really highly geospatially resolved data. And there are some time delays, of course, with these, as with many of these types of data systems. And then the third area of health data, and probably the most difficult for us all, is to work directly with providers and capture electronic health records or electronic medical records through hospital systems, medical practice groups, or other clinics. And so to the degree that you can work with such partners and get these data, there's potential for getting highly geographically resolved health outcomes data. There's the potential that the data can be accessed in a very timely fashion, and that one could explore a broad array of outcomes that might not be captured through some of the other data systems that tend to focus more on some of the more prevalent chronic health conditions, for example. And there are several disadvantages that I've already kind of hinted at, which have to do with data security, data quality, and just sort of the cumbersome nature of working with these data and having to do it on a sort of case-by-case basis with each particular provider. I'm going to go into 3 quick examples of how we've used different data sources within our work. And the first comes from Erin Simmons, who is one of our new investigators here. And she's engaging in a study looking at wildfire impacts on birth and developmental outcomes. And so, as you can imagine, for something like birth and developmental outcomes, we need a whole lot of different data sources to be able to get at some of the questions that she's interested in. So she's partnered with Todd Koch in the Vital Records Division at Montana DPHHS, and as well as Laura Williamson, the state epidemiologist, to get access to birth records. And then we're also so she's been working with those data, and we have come up with a system to get highly spatially resolved data. So it's not just getting county level reporting of birth outcomes data. We actually, in order for our research questions to be informed, we need really fairly precise spatial and temporal data on these birth data. So where that becomes problematic in terms of data release and data access is, of course, the data entities, the state in this example, will not want to share actual address of mother or actual health records dates like date of birth, specific date of birth. So we worked with this group to come up with a way whereby we geomask the residents and we fuzz the dates, like the date of birth and other relevant dates, so that the data are protected. And so this is we've got a procedural element to this, where we've got a really kind of cumbersome process of geomasking and protecting the dates and the identifying information. And then we've got an infrastructure established too to house these data in a very secure manner. So this has been a good collaboration we've developed in order to get these data. But as I said, it is cumbersome to work with these. And then for Aaron to get after this other piece of developmental milestones, that's something we're going to have to work on moving forward, which is going to be working directly with pediatrician offices or other health provider offices to capture these data. Cumbersome, but it's the level of data we would need to have in order to answer these questions. Another investigator here, Aaron Languth, is working with lower respiratory tract infection and trying to figure out all the various factors that influence children's risk of respiratory infection. And so as a starting point, she worked with Stacy Anderson at the Montana Department of Health and Human Services to look at influenza data that they capture on a regular basis. So this is just a time figure just showing the influenza data. And so she does like intensive mathematical modeling, looking at a variety of different factors and trying to figure out what influences influenza, in this case, influenza data, but she's also probably, eventually more interested in things like bronchiolitis or other things that impact children, young children. And so we'll be exploring hospital data, and we are in the process of capturing those data and going through similar kinds of geomasking and data protection steps to look at these data. And then another investigator, Sophia Newcomer, is working with children's vaccination coverage. And so she works with people in DPHHS's immunization section. And they've got this MTRAX vaccine monitoring program that is a great data set to evaluate the occurrence or the ability, or I'm sorry, the attainment of the Healthy People 2020 goal for vaccination coverage for children. In this case, this is just showing the 7 combined vaccine series coverage compared to national data and the Healthy People 2020 goal. And she's going to be exploring the MTRAX data. The figure represented here is not from MTRAX data, but she will be working with the state and these MTRAX data to better understand the barriers to early childhood vaccination. And so that's her goal moving forward. This is just, you can refer to this later, I suppose. I'm assuming Jane can share these slides with you at a later date, but this is just, I'm not going to spend much time on this in the interest of time, just kind of a clarification of difference between electronic medical records and electronic health records. So one thing that that Jane mentioned that there was interest in is how do we get a better understanding um, of social determinants of health, or data that can tell us about what we like to refer to as social determinants of health. So what we've done here is put together just sort of different areas where we might want to focus on understanding social determinants of health at the neighborhood level, and how could we do that? So we've grouped it into three different, and these are not by any means the only areas of exploring neighborhood level social determinants of health, but these are some. And so one is, how do we best understand the economic resources available to neighborhoods or communities or counties? And so we could use something that's referred to as the neighborhood socioeconomic status score, which can be derived from the U.S. Census using several different data that are available through the U.S. Census. You could also use something called the Montana Cadastral, and I'm going to flip to that website in a second just to show you how those data work. Or maybe we could also use primary care providers within 30 miles. And that would be using something called the Wyoming, Idaho, and Montana tracking system, which is a paid service that provides information about providers, health providers, and the density of health providers within different counties or neighborhoods, which can be a useful indicator of access to health. Social capital are things like, there are a variety of ways to describe social capital, but some ways that that can be captured using fairly easily accessible data is something like voter participation using the Harvard election data, which is a nationwide assessment of voter participation at the precinct level. And then things like mobility or migration indicators that are available through the U.S. Census American Community Survey. And then another arena for understanding social determinants of health might be households. Just would be an indicator or a marker of information and communication, which would be households with internet access availability, also available through the American Community Survey data. So I promised that I was going to show you a little bit more information about this Montana Cadastral. It's a really amazing data set. And in fact, Montana is the first state to have generated a GIS database of this type of information. This is housing value information, which, as you can imagine, is used, primarily for assessing taxes. But I'm just going to show you this website because it's pretty cool. Let me get back here to our. Okay, so so this is the Montana Cadastral website. It's it's a GIS based thing, and you can zoom in. I'm just scrolling in here. It might take a while for us to zoom into a particular neighborhood. Let's see where. Let's zoom into Great Falls, since that's kind of. Oops, I don't know why that just became blue. Let's see how. Okay, so it takes a while for it to buffer and kind of update. But as you can see, as we zoom in here, you can start seeing these pretty well-defined blocks. And I'm going to zoom in even more and just give it a second to update. And amazingly, you can see these are actual property tracks. And let me zoom in a little bit more. I'm not sure how close I can zoom in. Okay, pretty far. So you can select. And let's just look, you can over here, you can, on the right-hand legend, you could click on the aerial map if you want, if that's easier to help you locate certain things, or the topo map. But let's just, to keep it kind of simple, let's just go with this kind of grid layout. And you could click on a specific property, and I hope there's no one on the phone whose property I'm clicking on right now, but it's an amazing amount of data that they have. It's a little creepy, actually, that you could find out all this information about your neighbor's property. But some things in the interest of finding out information about, let's say, you know, like social capital, you know, you can find out property, you know, home values of your whole neighborhood that you're interested in if you wanted to, because they have these data just right here. And then, so they've got this tab under appraisals. They've got information about the appraisal value of this home. They've got information about the dwelling itself. And so if you're interested in some environmentally related factors, maybe you're interested in heating systems, or maybe you're interested in oh, I don't know, like insulation or other information like that. So just a really useful data source if you have the time or somebody that can really, you know, delve into this data set. And so that, you know, that's going to become kind of a theme here in terms of some of these newly available data sets, which is, they're cool and you can zoom it, you can create these maps or have these good snapshots of things, but to really use the data in an effective way does require some time and effort. And I'll point to this figure on your left here just as an example of that. This is just looking at the Harvard election data set. And so you can, as I mentioned, they've got information at the precinct level, the voter precinct level, about like proportion of, you know, voters in each precinct. And so that maybe that tells you something about social capital, you know, or something like that. But there is also a challenge because the precinct lines don't match the census block lines. So there are, you know, methodological challenges in terms of knowing the right denominator or assigning a particular voting percentage level to a census block. Because as we'll see in a moment, the key to linking these different data sources is being able to have the same geospatial characterization, right? So you're not going to have health outcome data at the precinct level, but you might have it at the census block level or the county level. So being able to integrate these different data sources and deal with the different polygons that the data are included in is it can be challenging and time consuming. So I don't want to ignore the problems with some of these data. We already mentioned the American Community Survey. There's a website here for those of you that are interested. If you want to like take a look at the Harvard Election Data Archive. I mentioned this Wyoming, Idaho, Montana tracking. There's a link below there. That is a subscription-based service. It's but it is, if you are interested in learning more about the health provider density in your community, then this might be a resource for you that would be helpful. As I said, there's a cost associated with that, but they do provide GIS mapping tools as part of that, so it could be useful for some. So the other thing when we talk about social determinants of health or different influential factors on health, you know, the one area that I tend to focus my attention on is environmental areas or environmental exposures. And so there are lots of pretty easily accessible tools for environmental data. And just to give you an example, here's the air quality site for the Montana Department of Environmental Quality. I was going to take you to this site, but I think in the interest of time, I will not do that so that we can keep moving along and be sure to have time for questions. But this is a good source for data, but one of the challenges you can see is that there is a limited monitoring network. I mean, it's still quite a bit, but you know, there's going to be a lot of areas that are not covered by this air quality monitoring network. So there are strategies, and my colleague Erin Languth and others that she works with are working on getting more spatially resolved data that could be applied, down to the neighborhood level, really, which is the reason, of course, that we're interested in that is to try and get a better handle on wildfire exposures that are very, seasonal phenomenon, but they do impact a lot of our communities in Western Montana, and we know in order to better understand the health outcomes associated with that, we just need better spatial resolution. So we're trying to get down to a much more refined exposure modeling using a combination of those ground-based sensors and satellite data. So I would go back to that as being something that's sort of not readily available, but it's going to be sort of much more spatially resolved than what's available elsewhere. And then green space is another sort of topic that's been hot for a couple of decades, and even more so now. The figure at the top is something you could go to this website through the Montana Climate Office at the University of Montana, and you could zoom into your community and know what they call the NDVI, the Normalized Difference Vegetation Index, is for your community. I know you can't see the scale here on this, but in this case, the lighter shadings of gray are more vegetation, and the darker shadings of gray are less vegetation. I guess that sounds counterintuitive, but that's just the way they've got this particular map. There are more enhanced versions of this where, vegetation is actually colored green. So that would probably be easier to visualize that way. But one of the problems of using just NDVI is that doesn't really, it tells us something about how much greenness there is, but it doesn't tell us much about accessibility to that greenness. Like, it doesn't tell us necessarily about the difference between a park and a tree, or a park and a forest. And so in terms of what we might want to know about greenness and the impacts on health, NDVI by itself might not be sufficient. But there are lots of other tools as well. That the figure on the bottom here is just showing from the USGS. In this case, it's showing protected areas for, these are just public lands that are shaded green in this particular look at it. And you could go into the same data set and just identify recreational parks or other things. So those data sources are good as well. So kind of along the way here, I've talked about lots of challenges, and a lot of that has to do with, in some cases, the more spatially resolved and temporally resolved, and in some ways more interesting data has its challenges with respect to access and ease of use. So that's sort of a trade-off there. And then whenever we're combining data sets, which it can be really challenging. I mentioned sort of the spatial problem with bringing in different data sets, but there's also, like, if we're getting down to individual level data, there's also a challenge in terms of knowing or being able to link on particular variables or factors. So that's always a concern when dealing with multiple data sets. And then, of course, quality control is certainly something to be concerned with. I want to end on a final note, which is just sort of to plug our School of Public and Community Health Sciences as a willing partner to work with you or any local health departments on projects that you don't have time to do. And so our Masters of Public Health students have to do capstone projects, one of which is an applied practice experience. And it just provides students with an opportunity to work in a real public health setting. I mean, not necessarily on site. Some of this might be distance-based, but really to work with, someone that's actually working, in the trenches and public health offices. But maybe you need some help in working on some data or a particular question that your community wants to have more information about. And so in this sense, for an APE, for one of our students, a local public health official would be a site mentor that would work with that student and along with one of the faculty members in our program to come up with a project that is useful, not only for the student, but for the local public health agency as well. And then a related capstone course is called an integrative learning experience, which just has some different elements, but it's also something that our students have to do, and working within a local public health agency could be a really good way to do for students to engage in this project. This is just one example here where student Elizabeth Williams worked with, in this case, the state health department on some data systems and integrating some vital records and some exposure data to look at a particular question that she was interested in. And then, we are always looking for ideas of how to integrate, Montana relevant questions and data into our courses. And just to give you an example, I'm just going to point to this, the second example here of, which is really, it's a course for our new PhD program. It's an advanced qualitative research methods course. But as part of that course, Erin Simmons has worked with the Montana Department of Health and Human Services to use a protected birth certificate record data set so that the students can explore interesting questions just on Montana birth outcomes. So that's just an example of how we could, use ideas or data sets within our coursework to answer questions that you might be interested in. So I encourage all of you to reach out to us if you have such interests or questions that you want that you're willing to integrate within our coursework. Finally, I'm just gonna leave you with a couple of things that are on the horizon. One of which is called, it's a newly developed center that we developed here. It's called the Center for Population Health. It was recently approved by the Board of Regents. And this was part of a large center application that we submitted to National Institutes of Health. It's really focused on developing and testing interventions to improve rural children's health. But we plan to have a more expanded goal that is really about more generally dealing with any population health issues that we face in Montana, particularly in our rural communities of Montana, and how we can better capture data, health data, and other sources of data to inform the questions and the solutions, of better understanding the answers to the questions, but also informing the solutions to improving children's health. And so a key piece of this center is what we call the data, that's a typo, it's actually the data and modeling core. And so that just provides an infrastructure for us to work with hospitals and clinics to capture sensitive health data, protect it as it needs to be protected, but still being able to provide researchers and public health workers with the temporal and spatial resolution that's needed to answer some of our questions about the health of our populations. And then that same core also provides lots of biostatistical and geospatial and exposure modeling expertise. And then the last slide, and then I'll cut to questions, is just like what can we look forward to in terms of big data or real-time data that can be interrogated for a better understanding health in our communities. I don't really know the answer to this question, but I know there have been studies that have sort of called digital epidemiology, where they have explored social media data, for example, to better understand, at least with using lots of data, lots of messy data, to understand people's reflections on or comments on or concerns about particular health issues. As you can imagine, this is the data. This is the kind of data source that, as I said, is messy. It also requires a lot of understanding about language and lexicon that's used in these social media sources, that of course is constantly changing as well. So challenges and potential opportunities with using these types of data. And then the other thing that many of you are aware of that is, soon to come, we hope, is the Montana Health Information Exchange, which is a way, the purpose of that is really to build upon some of the dictates of the Affordable Care Act, which are all about, moving more towards electronic health records and integrating data across different systems and providers. So that's sort of the overarching goal of that. The degree to which that effort can be used for local public health agencies to better understand health in their communities is uncertain, but I hope that is sort of on their radar screen in terms of using those data for that purpose. So I'm sorry that I didn't hear anybody chime in and ask questions while I was talking, but we do have an opportunity now to ask questions. So I'm going to stop sharing the screen and just see if I'll just open up the floor, see if there are any questions.
I just unmuted all, but I see that some folks have muted themselves. So just take it away.
Curtis, this is Oakley and Billings. On your rural child health, it might be interesting to look at which of the, geographically, is there a school nurse in those rural schools?
Yeah, I think that is a really hugely important question. And, as we know, the resources for school nursing have been going down for years and years. And Montana is actually, my understanding, is better than most states, but still there's a huge gap there in terms of coverage of nursing in schools.
On May 10th, Senator Tester at 3 o'clock Eastern time will be introducing the Nurse Act, which has to do with rural school nurses. But school nursing falls under me and Billings, so that was just something that jumped out at me when you had your rural child study up.
Yeah, thanks, Marilyn. Thanks for that. And that is definitely an important factor to consider in our look at understanding the infrastructure and access to preventive health services in our communities.
Other questions? I see Anaconda Deer Lodge looks like they're ready to ask a question. Go for it, Kitty.
No question.
Okay. I think, we're just reflecting back again on that term of big data. It is such a promising concept that, we will have all this data available to us because we've got all these electronic health records, et cetera, or as I said, social media or something. But, once you get into the weeds of these data streams and data sources, it becomes more challenging. Not that we won't get there at some point, but I guess I don't feel like we're really quite there yet. And in fact, the reason that we here at the University of Montana engaged in our own effort to serve as a data infrastructure to house some of these, to capture and house some of these data and work with these providers to access these data is because we couldn't just wait around for all these systems to come into place. It just seems like we're still a long ways away from having these accessible integrated data systems on health outcomes in near real time.
So this is Jane. I'll pipe up. I think it's a real opportunity to kind of have a conversation with Curtis. If anyone from more rural areas is willing to kind of step up, I think Curtis did a good job of describing how tough it is to work with some of what is available, given sort of the lack of capacity in many areas. Could anyone at a rural or frontier local health department describe the challenges you all face that could give Curtis an idea how the university might be able to partner with you all.
Jane, this is Kitty. Can you hear me?
Yes.
Yeah.
I'm in a small county, a small rural county, where the challenges are the data set and the pool of data is so small that sometimes you run into a HIPAA problem because people might be more easily identifiable than in a larger community. That's one aspect. And another aspect is we just don't have enough data. We don't have enough people to query to make it relevant.
Yeah, I mean, I think what you've just described is the challenge for most of our Montana counties, you know, and most of our communities in Montana, that they're, you know, the sparsity of, first just the access to the data, but also just the fact that the populations are so sparse that the counts are not going to be sufficient enough for data entities to be able to release those data. So, I mean, yeah, you're describing an important challenge. Now, one way to deal with that, of course, is to either combine across time or combine across space. And so, you know, both of those things limit what kinds of questions you can ask about the data then too, right? But
Right.
that is the possible strategy to look at that.
Because I'm thinking back on an experience that we wanted to use the data so badly, but we couldn't. Was in 2012 when we did a blood lead testing on Medicaid children in the community.
Yeah.
And we had, at the time, I was working for another entity, and we had GIS capabilities. So we mapped all the kids, we mapped all the houses, mapped everything where the kids were there, but we couldn't use that data, those maps for any, because it's too, you know who they are. You know, the place is way too small. It did identify, though, areas of concern where potential contamination could be located. So in that sense, it was useful, but that's I'm a bit of a data geek. I love data, which drives me crazy.
Right. Well, you know, yeah, I think that's a great example that you just shared, and you know, I think we should always think about. I know I showed a lot of maps, you know, but really, you know, when you're collecting data for this very reason that you described, you shouldn't think of it as like because you want to show a map of where the problems are. Really, you know, we all need to be super careful about showing maps, because that is where the problem, you know, comes into play. But if it's just for informing your own department about where to focus your efforts, that's really answering the question that you want that you're asking, right? And
right.
You don't necessarily need to share that map with your community. And
no, we didn't, obviously.
Right. And so it's fun to share maps because they look real cool, but in situations like the one you're describing, that's the last thing you would want to do, but you still have the data that you need in order to move forward.
Curtis, I don't know if you can see Matt Kelly from Bozeman has asked a question about how you're projecting the prevalence of conditions like diabetes.
Right. Yeah. So, for example, in the case of Missoula or Billings, you know, where the data were based on those 500 cities, you know, that was based on primarily on the behavioral risk factor surveillance surveys integrated over a couple of years, I think. But when they don't have, you know, it's only but you can also get it at the county level. You can get those same data from the behavioral risk factor surveillance survey.
And then you could use demographic data to go deeper into neighborhoods, I would think.
Well, you could go in more deeper. You can get demographic data for your neighborhoods, but it would be but sometimes it can be difficult to get health outcomes data at the sub-county level. The other thing I would encourage you to do is to use that IBIS system through the state. But some of your counties might run into similar problems with respect to data suppression, what they call it data suppression, but really it's just the problem of low counts. So in very rural counties, that may be a problem. But it shouldn't be a problem for something like diabetes. There should be enough diabetes in your community that you'd be able to look at the IBIS data. And they've got on that website for the Montana DPHHS IBIS, there's a tutorial that you can click. It's just a YouTube tutorial that walks you through how to use that system if you haven't used it already. But the only other thing that that I could suggest would be working with your providers in your neighborhood if they're willing to share these data somehow. But that that's a whole different can of fish then, I guess. You got to get into kind of data use agreements, etc. So it's not the easiest route for sure. Someone just asked how many years of IBIS data are there. To be honest, I don't know. The hospital discharge data system has been in place only for a few years. Jane, do you know when that kicked off?
The hospital discharge probably 10 years ago, 15. I'm not exactly sure, but I think that the answer to the question is really it depends on what data set you're talking about.
Yeah.
How many years they've uploaded into IBIS. So it varies, Karen, according to the data set.
Yeah. Yeah.
What else? Anything else you guys want to kick around with Curtis?
Yeah, or you feel free to shoot me an email too if you come up with a question for later. That's
Yeah, and I'll provide his email to you, and I'll also post the video, of course, and the slides from today's conversation. So just really want to thank you, Curtis. Appreciate you jumping in here, and really interesting what's out there and what's happening in different communities. So thanks for bringing all that to us.
You bet. Yeah, it was fun. It was fun being here, and yeah, do it again soon.
Okay, thank you so much.